In this presentation, we will be going over SBAR reporting. Why use SBAR? SBAR is a format to plan, structure, and communicate information about an issue or problem, clinical or non-clinical. SBAR is an error prevention tool that should be utilized. SBAR can be used in other situations where communication needs to be clear and concise. When do you use SBAR? SBAR should be used to communicate with the provider about a patient's situation or status. SBAR should be used at shift change to communicate critical information. SBAR can be used to communicate other problems in a non-clinical setting, i.e., management or logistics. SBAR stands for Situation, Background, Assessment, and Recommendation. Under situation, you want to include who or what you are calling about and the immediate problem. You want to paint a good picture of the situation. This could include any pertinent assessment findings directly related to the problem. It may also include vital signs and your interpretation of them. State information that will get the provider's attention. Under background, you want to include a brief description of relevant history related to the problem or condition, what has led up to the situation, and what you have already attempted and the response to your interventions. For the assessment, you want to state your view of the situation, also including your perception of the urgency of the situation, and include or reiterate any supporting assessment findings. It could include your suggestion about you would request guidance on what action should be taken. Or you could include your suggestion about what action that should be taken to resolve the problem or issue. The following is an example of an SBAR report used in a clinical situation. This is an example of an SBAR report used in a non-clinical situation. The following are a few tips and pointers for SBAR. It is important to know that each provider might want different information. Getting to know the providers that you regularly work with might change the information that you gather. Gather all the information that the provider will need to make a decision in the care of your patient or fulfill your request before you call. Remember to pass on all crucial information at shift change so that the nurse taking over can safely and adequately care for the patient. Fully document all information that is communicated and include the response to your requests and interventions.